Welcome to this Nursing Times webinar on enhancing your continence care skills. My name is Steve Ford and I'm the editor of Nursing Times. To coincide with World Continence Week taking place in June, we have created a series of 5 free webinars which are supported by an educational grant from Essity. Designed to provide general nurses with accessible educational content, the series is designed to help you to develop your practice and improve the quality of continence care delivered to patients. Across the series, our expert contributors will explore the following key principles of continence care: male incontinence, continence and transgender people, children with complex needs and their transition to adult services, acute stroke and transition to community services, and how digital technology can help improve access and support the care of patients with continence problems. Each webinar will feature an expert nurse who will provide a clinical update on these important themes, followed by a question and answer session. You'll be able to watch back each webinar afterwards or catch up on any that you've missed. In this webinar, we'll be exploring children with complex needs and the transition to adult services. Our guest speaker is Brenda Cheer, a paediatric specialist continence nurse at ERIC, the Children's Bowel and Bladder Charity. Thank you again to Essity, and now over to Brenda.
Hello, I'm Brenda Cheer. I'm a paediatric specialist continence nurse. I've specialised in the field for the last 20 years. My principal job is as ERIC nurse, working for ERIC, the Children's Bowel and Bladder Charity. I've worked for the NHS for 35 years, but I left in 2018 to focus on my work with ERIC and with Shine, the Spina Bifida charity, on freelance teaching and on a small cohort of private patients. Several different jobs, but just one subject. I only ever talk about children's wee and poo. I'm guessing that some of you are familiar with ERIC, but for those who aren't, let's just watch a little video explaining who we are and what we do.
Welcome to ERIC, the Children's Bowel and Bladder Charity. For over 30 years, we've been dedicated to improving the lives of all children and teenagers in the UK facing continence challenges. Our vision is for all children and young people to live a healthy and happy life regardless of any bladder or bowel issue they may face. At the heart of ERIC is our free helpline. We're staffed by a small team of expert advisors providing information, signposting and confidential support for young people and anyone who cares for them. The ERIC website is packed full of resources for families, children, health and education professionals, including videos, blogs and podcasts. The Help at School area features best practice guidance for managing bowel and bladder issues in nurseries, schools and colleges. Our Children's Continence Pathway is a fantastic resource for healthcare professionals. You'll find downloadable guides covering the management and treatment of bowel problems, day and nighttime wetting and much more. We offer training for healthcare and education professionals, early year practitioners, alongside parent workshops. The ERIC online shop has a huge range of bedwetting alarms and other continence products for children. The profits we make are invested back into running our charitable services. We support our community with fundraising events like our charity skydive and campaign for our causes. Our Let's Go Potty campaign is dedicated to supporting families and anyone working with young children with every stage of the potty training journey, from nappies to pants. Visit the ERIC website to find out more about what we do.
I do a lot of online teaching, but it's always live, never recorded. So I'm used to a lot of interaction with my audience, through polls, through the chat, through inviting individuals to unmute and take part in live case. Today is different. I'm recording this a couple of weeks before you'll see it, so my challenge is to imagine the conversation I would have with you. I would ask about you, about your job titles, your experience in this area of nursing. So I'm going to guess we've got a broad mix of adults and children's general and specialist nurses. I would ask you what you understand by the title we've been given today. In particular, the first half. Children with complex needs. What springs to mind? Complex bladders? Complex bowels? Complex physical abilities, complex learning abilities, complex behaviour, problems with communication, with mobility, sensory needs, congenital anomalies. Some of those? Perhaps several of those. It's not just us who are challenged by the complexity of the children we care for. When it comes to transition to adult services, there isn't necessarily an obvious route to take. Let's just compare the remit of the typical paediatric continence service with the typical adult continence advisor's caseload. Looking at the children first. So we have the obvious constipation, soiling, day and nighttime wetting. Whatever work is going to be done on toilet training will be done during the childhood years. All the surgery to correct congenital anomalies will also be done as a child or young person. And techniques to manage bladder and bowel will be learnt during those years too. What about the adult list? There isn't much overlap, is there? Of course, there are some things in common. Constipation occurs frequently in adults and children alike. But the first-line treatment for childhood constipation is laxatives, whereas dietary change would be the first suggestion in adult patients. We could spend the next half an hour tying ourselves in knots over who does what and when. Or we could focus on meeting individual children's needs, on ways to promote continence in all children, and the best preparation for transition to adult services. So let's do that. In the short time we have available today, I think the best thing I can do is to give you a whistle-stop tour of the resources available on the ERIC website, signposting you to family resources and professional resources to help manage childhood constipation, daytime bladder problems and nighttime wetting, and to help support children with additional needs and those living with complex bladder and bowel problems. So let's go to the ERIC website now. You may be familiar with it already, but there are always new things being added, so I'm sure everyone will find something new to look at. So, here's the ERIC website. Where should we start? Well, if you have known ERIC for a long time, you'll be familiar with our range of leaflets, such as ERIC's Guide to Children's Bowel Problems. We're now in the process of transitioning to a new format with a range of advice sheets. Why is that? Well, in general, of course, there's a move away from paper to online resources. Also, people don't necessarily have the budget to purchase paper resources or the storage space to keep them. But also because we want to make information available to as wide a range of people as possible, including people for whom English is not their first language. You can now translate the whole ERIC website into one of 18 different languages, with the possibility of adding up to 99 in total. We're adding more languages as people request specific ones. So how do we do it? Well, I think you can see on your screen already, we've got the little flags in the corner. So let's just click on one and see what happens. Well, that's the whole ERIC website in Ukrainian. Who knew that's what Ukrainian looked like? So anything on a web page is translated, but not downloads. Hence our transition to advice sheets, because they can be viewed as web pages. You can still print them though, if you want to. Let me show you. I think we'll just change back to English first of all, if that's okay with you. Okay, so let's look for some printable resources. Something equivalent to the ERIC's Guide to Children's Bowel Problems. If we go to the Families tab and then drop down to Bowel Problems, then you can see a range of tabs we could land on. If you've known ERIC in the past, you'll know that we've always had a lot of information in the bowel problems area, but previously there was just such a lot of information. People said, I just don't know where to start. So now we've got a tab saying exactly that, where to start. As we look down the page here, you'll see that we've got loads of really family-friendly information. It talks about things that real people say on the helpline calls. It talks about how common the problem is, reminding us that 1 in 3 children will struggle with constipation growing up. It's a really common problem. That's probably going to reassure parents. You can see that it's peppered with loads of links to different areas of the website that are going to be really helpful, including our new withholding area, which we can look at in a minute. Keeping scrolling down, you'll see we get to our advice sheet for children with constipation. So let's have a look at that. Anything that's on the web page, as I say, can be translated into any language, or we can download a print-ready copy. So let's have a look at that now. It starts off by explaining how the bowel works. We want parents and patients and families to follow the advice we give and follow the treatment plans, and they've got to have a good understanding of what is happening. What's the rationale for the treatment that we're giving? So let's start off by understanding how the bowel works and what can go wrong, with a reminder there of how common constipation is, and a reminder that we're not going to wait for it to get better by itself. We need to take action. Scrolling down, we get to the poo checker, and you'll recognise this is just the Bristol stool chart with the same pictures and the same descriptions of the stools. But now we're adding some little pieces of information to help interpret what we're seeing. So type 1, type 2, type 3 all suggest constipation. Type 4, you can see by the happy poo here that that's the kind of poo we're aiming at. Scrolling down, type 7, liquid stool, could be diarrhea, could be overflow. How can you tell if a child is constipated? There's a list of all the symptoms that the family might experience, with a reminder that just 2 of those symptoms will give you a diagnosis of constipation. How do you treat the constipation? Well, first thing to do is to gather some data. So we might keep a poo diary to record all the information. We can just click on the links to get to the poo diary. And there you'll see, like all the charts and diaries on the ERIC website, we can print instructions or advice for the family completing it to help ensure that we get all the correct information the first time it's done. So the advice is to take the poo diary to the GP, and the GP should do a physical examination to rule out any underlying organic cause and prescribe a macrogol laxative. How do we take the macrogol laxatives? Well, we've got links there to our 2 most commonly and most frequently downloaded fact sheets on the ERIC website: how to prepare macrogol laxatives and the Parent's Guide to Disimpaction, packed full of really easy to understand information about how to go about giving laxatives and giving them in large doses to disimpact. When we've done that, we want to focus on getting the poo in the loo. So there's all the steps to effective toileting, including a link to the toileting reward chart, where parents can really work out the ways to get their child to conform and do what they want the child to do. All the tips for parents there to how to encourage children to get the poo in the loo. At the bottom of the advice sheet, there's just some links to sources of further information, such as, scrolling down, we'll find it, such as a little video, The Pooper Highway. So it's just a brief video, and it's really an excellent summary to explain why children get constipated, how it should be treated. So it's a summary useful to remind us how to go about it, but also a really useful resource to share with parents. So let's have a look at it now.
A third of all children struggle with constipation. It doesn't mean you're a bad parent, your child is eating the wrong things, or they're being lazy. It's a common medical condition which some of us are just prone to, even babies. By the age of 3, children should be doing at least 1 soft poo a day. It shouldn't be so big that it blocks the toilet. Pooing fewer than 4 times a week shows that the journey from mouth to bum is taking too long. Poo is sitting in a traffic jam. Water keeps being absorbed, making poo hard and tricky to pass. Going more than 3 times a day can be a sign that the bowel is full of poo and only little bits are allowed out at a time. It might even be runny poo leaking around old poo, often mistaken for diarrhea. Poo problems won't go away without the right treatment. The sooner you can get to grips with it, the better. Keep a poo diary for a week or two and note what each poo looks like. Your child needs to be assessed by a doctor. Take the poo diary and describe any other symptoms. Feeling their tummy for hard poo is only one part of the assessment. The doctor should also ask lots of questions to make a diagnosis. The best way to treat constipation is with macrogol laxatives, which soften poo and encourage the body to push it out. It's a powder which must be mixed with the right amount of water first to work properly. It can then be added to drinks or food. Lots of the laxative is needed at first to clear out all the old poo. This is called disimpaction. This can feel daunting, but be brave. Under-treating constipation will do more harm in the long term, and laxatives won't make their bowel lazy. Things may get worse before they get better. To keep constipation at bay, a smaller daily dose will keep poo soft and moving along. An effective toileting program will help the bowel to empty in the right place. There's no magic wand for treating poo problems. It will be hard work for you and your child. Bowels can recover with no lasting effects. For more information about healthy bladders and bowels and constipation, go to the ERIC website, eric.org.uk/bowel problems.
I hope you enjoyed that. I always enjoy watching those little, I think it's Inspire, the little poos driving along their cars along the bow. So where should we go now? If we go back to the Families tab and drop down to this area, withholding, this is actually a most recent area to be added to the ERIC website. And it's, as you can see, it's packed full of information about children withholding. Withholding stool is incredibly common. Some children withhold wee as well. So why do they do it? And how can we help them? How can we support them to feel more comfortable perhaps around their poo? What do we need to understand about toilet anxiety? You can see here another whole resource about toilet anxiety, understanding it and what we can do about it. So that's the withholding area. Where should we go now? Let's have a look at bladder problems. Starting off with the daytime bladder problems. And like with the constipation, we've got an advice sheet for children with daytime bladder problems. So let's have a look at that. Just like the constipation one, it's all there on a web page, so we can translate it, or we can download a print-ready version. And what's inside it? Well, it starts off with some reassuring words that actually bladders often misbehave in childhood and almost all are functional problems. It explains that most children's bladder problems can be really sorted by really working on the 4 steps to a healthy bladder. Starts off though by explaining how the bladder works, because once again, if the family understand how the bladder works, they'll understand the rationale for the treatment which is being prescribed. And then we move on to the 4 steps to the healthy bladder. The first one, check out the bowel. How does constipation affect the bladder? How would you check? Step 2, looking out for a urinary tract infection. How would a UTI affect the bladder? How would you check? Because sometimes children don't seem ill, and you wouldn't guess they had a UTI. Third step, get the drinking right in every facet. Having plenty to drink, spreading the drinks out, drinking the right things, and knowing what to avoid. Before we scroll on, let's just nip back and just have a look at our wee checker there. So the wee checker is just a hydration chart, which I'm sure you're familiar with. But like with the poo checker, we've added a little bit of information to help interpret it. So the lighter coloured wees here, good, keep up the good work. As we look down, so the darker wees here, oh, you're dehydrated, you really need to have a drink soon. Or the really concentrated wee here, so you're severely dehydrated, thirsty, you should be. You're way overdue, several big drinks. Get drinking as soon as you can. Your bladder and kidneys are not happy. Hopefully messages that children and young people can understand, with a reminder on there on how much we should drink, how big the cup size should be, etc. So that was the wee checker that we jumped onto that from the 4 steps to a healthy bladder, and that bit was all inside the get the drinking right in all its facets. And then of course step 4, the importance of relaxing to wee. With a reminder, don't worry, things might get worse before they get better. But what if problems persist? What do we do? Well, again, we need to collect some data, so we could click on the intake output chart, collect some information on there, take it to the GP, physical examination, and to rule out any underlying organic cause, and then the GP will do a thorough assessment to work out what's going on. Meanwhile, though, what can we do to help manage the problem? Well, if we have a look in the ERIC online shop, we can see that there's various items of clothing which can help add some dignity. So pants with concealed pads in them, and also, of course, in the same area of clothing, we can see the continence swimwear. So even if children are having soiling problems, yes, they still can go swimming. So lots of products there which might help to support the family, help them to manage living with a continence problem. So that's the daytime bladder area. About night times, back to families tab, bladder problems. Oops, families tab, bladder problems, down to bedwetting. And a good place to start is with another little video. So let's have a look at this one. Another very short video, Become a Bedwetting Detective. I hope you enjoy watching it.
Did you know that you don't have to wait for children to grow out of bedwetting? From the age of 5 years, piles of washing, sleepless nights, and missing out on sleepovers aren't something any family should have to struggle with. There are lots of different reasons why nighttime accidents happen, and treatment is available. First of all, there are some basic things to put into place. There are also clues to look out for to try and work out what's going wrong. 1. Are there clues in the poo? Look for constipation. A full bowel takes up the space where the bladder wants to stretch and fill. 2. Are there clues in the way the bladder is behaving during the day? A bladder that squeezes when it shouldn't might empty during sleep. 3. Are there clues in how much and what is being drunk? What's put into the bladder influences what comes out. So drinking plenty of water-based fluid during the day should prevent thirstiness at bedtime and help the bladder to hold more while we sleep. 4. Could the bedtime routine hold the key? There are ways to help the body and mind prepare for sleep, including stopping drinks an hour before bedtime, having a screen-free bedtime routine, and going to the toilet just before settling down to sleep. There's lots that can be done to treat bedwetting. Look for all these things in all children. If bedwetting continues to be a problem beyond the age of 5, children should see a doctor or a nurse. They can assess the reason for wetting and give advice on specific treatment. For more information about healthy bladders and bowels and bedwetting, go to the ERIC website.
So I hope you enjoyed that little video, and I think you'll agree that that's really accessible information for children and families. What's also hopefully accessible information is the advice sheets for children with nighttime wetting. Like the other two advice sheets we've looked at, you can get to a print-ready version, and it starts off just by putting things in context. You know, bedwetting in childhood is really, really common. Yes, it does run in families. And there are nice guidelines which tell us how it should be treated from the age of 5. But first of all, we have to work out why the child is wet. So constipation can cause nighttime wetting. Some children have bladder problems in the daytime too. So really work on those 4 steps to a healthy bladder that we've already looked at. What about if we're doing that healthy bladder management and the child is still wet? What do we do then? There's our bedtime checklist, all the straightforward things to do first. If we've done that and we've still got ongoing wetting, we need to find what is causing it. So it could be because the child is finding it hard to wake up when they need a wee, or because they get really wet, because their bladder doesn't stretch enough, or more than one of those reasons. So what do we do to find out the predominant reason for the child's nighttime wetting? Complete a nighttime diary. And then from the nighttime diary, we'll be able to work out what's going on and find out the predominant reason for wetting, which will help us choose the optimum treatment. Be it a bedwetting alarm, desmopressin, some other medication treatment, and there's links to sources of further information. if we just go back onto the website there. So I've shown you various things that are in different places. If you want to see something where everything is located usefully in the same place, if we go to the Families tab, we can scroll right down to the Resource Centre and see fact sheets and downloads. And there's a whole list of things, including the ones we've looked at and a whole lot more besides. So that's quite a good place to go to get just to go quickly and easily to the Resource Centre. Also, if we go to the Families tab and down to the Resource Centre, we can see not only have we got those fact sheets and downloads, but we've got podcasts, we've got videos and apps, so much useful information. Just on the subject of children with complex bladder and bowel problems, we've just got one specific resource for children with complex bladder and bowel problems, and that's our guide for children living with complex bladder and bowel problems. This one's still in a leaflet format at the moment, and what you can see that we've got here is some very happy children who are going to tell us about their bladder and bowel problems, a range of complex bladder and bowel problems, including functional problems that don't respond to regular treatment. All these kids are just saying that they've all got wee and poo problems for all these different reasons. They're all different, but they're all the same because they're amongst the many, many children that have a bladder or bowel problem. And then they go on to explain some of the things they do to sort their wee and poo, like catheters, like bowel washout systems. There's lots of information there, including links to other organisations who may be able to support them, and some specific links to areas of the ERIC website, which will be particularly useful for this cohort of children. So that's ERIC's guide for children with complex bladder and bowel problems. So we've looked at information ideal for families. We've also got our kids and teens tabs here, so you can get child-friendly information, parent-friendly information. But now let's go to the professionals area and see the ideal information for professionals. Let's click on the Children's Continence Pathway. So the ERIC Children's Continence Pathway is a generic pathway. It's not about service provision, which would be different from area to area. It's about the child's journey through continence care. It's about the child's individual continence needs. If you read through this blurb at some point, you'll see that it seats the pathway into the context of national and international guidance. Everything that we say is not just a law according to ERIC. What ERIC does is to collect the best practice information from national and international sources, so from the Paediatric Continence Forum, from NICE guidelines, from the International Children's Continence Society. It takes all that best practice information and puts it into user-friendly formats, the child-friendly, the parent-friendly that we've already looked at, and the professional-friendly that we're looking at now. As it says, it starts with a children's general continence flowchart. And if we look at the flowchart, we can see that it all starts with a parent or carer identifying a concern regarding continence. Worth noting that if the parent or carer contacts ERIC via the helpline or visits the website or speaks to their nurse, perhaps that's you, that information could be obtained and self-help measures may be employed, which may prevent the child's journey through continence care. What am I thinking of here? It could just be that the child has an abysmal fluid intake, and if they correct that, it sorts out their continence problem. But for most families, they're going to identify a concern, and this child's symptoms need to be documented by their level 1, tier 1 nurse, somebody like us. We could use the ERIC continence assessment form. As you can see, there are two versions, one for the child that has been toilet trained, one for the child that hasn't yet been toilet trained. I'm clicking on the one for the child that has been toilet trained just because it's got more in it. You can see that we can now use different, there's 3 different versions of the form we can click on. So we could download a Word version of the form, which will enable you to adapt the form for local use. And there's the criteria, what you need to do that there. We can download a print-ready copy of the form. And like all assessment forms, it starts off with the usual demographics, name, age, date of birth, etc., past medical history, medication. And then we get to the bowel section. So just note those first questions that we're going to ask: the frequency of bowel actions, the stool type, is there any soiling? And let's look back at the online version of the form. Can you see the online version here? You can see those same questions on the left, frequency of bowel action. And on the right, we've got another column, a column that tells us what normal is and what a deviation from normal might mean. So the second question was about stool type, wasn't it? So it interprets what do the different stool types mean. The third question was, is there any soiling? And there's a reminder that if the child is soiling, always suspect constipation, remembering that almost all childhood soiling is caused by functional constipation. There's questions about what the child wears. Is there a regular toileting program in place, just so we can complete the picture? And then questions about, is the child passing large stools, large quantity of stool, abdominal pain, pain on defecation, abdominal distension, anorexia, nausea, other associated behaviours, all the things which point towards constipation. It reminds us that the child doesn't have to display all the symptoms to be diagnosed with constipation. According to NICE guidelines, and there's a link there, 2 or more findings indicate constipation. And it says if constipation is indicated, follow the flowchart for constipation. So let's have a look at that. Top boxes are about the person who looks after the child, and it says about if the constipation is identified by the GP, they need to talk to whichever is the relevant nursing team. Or if it's a nurse that finds out about the constipation, they will need to refer to the GP. But the family needs the help of nurses and doctors alike to manage this constipation. The next thing that needs to happen is assessing for an underlying organic cause. And all the little boxes with an eye on the pathway, if you hover over them, then you get a little pop-up with some more information, for instance, just telling us who the physical examinations are usually done by. It lists there all the things which need to be done as part of that assessment, looking for an underlying organic cause. And there's even a poster that you can click on, done by a GP, putting it into a nice pictorial format, what comprises red flags, what comprises a normal examination. So lots of things to click on within each flowchart. If we've got concerns, refer as appropriate. If not, this is idiopathic constipation. And then we've got the journey here to work out how to treat it. For most children, that's going to include disimpaction. We either find impaction or we suspect it, and we need to disimpact. Sometimes we can just bypass the disimpaction box and go straight down to maintenance. And you can see that there's links to all sorts of supportive information, which is really going to help the child and family to get on top of the constipation problem. For most children, when we've done that, symptoms have improved, and that's fine. Sometimes symptoms are ongoing, and we need to refer to the local paediatric continence service for a further intervention to help sort out the ongoing bowel emptying problems and prevent soiling. And just one other thing to show you on this one would be to say that the significant part of that journey could be just summarised by looking at the Eric Poo ladder. If we climb a ladder, we usually start at the bottom and go one rung at a time to the top, don't we? So that's the message here. If the child's got ongoing bowel emptying problems, we're not going to go straight from treating constipation to perhaps a surgical intervention. That's right at the top of the ladder. So many things that we can do in between, using perhaps daily suppositories, mini washouts, or more simple washout, more complex washout, different forms of transanal irrigation before we consider the need for surgery. So I think you'll agree that there's lots of information packed into that flowchart, which is giving the child's complete journey through care of constipation. If we go back to the children's general continence flowchart that we started off at, you can see that not only is there a flowchart for constipation, but there are flowcharts for 5 different sets of symptoms, including daytime bladders, nighttime bladders, and one for children with additional needs. So let's have a look at that now. The flowchart for children with additional needs, once again, starts by thinking about who the child might see. And this says, let's give this family some information. So let's click on the Eric's Guide for Children with Additional Needs and see what's in there. Again, this one's still in a leaflet format. and you can still get hold of paper copies of this. It starts off by saying the main message for parents is just because your child has a physical or learning disability, it doesn't necessarily mean that they can't be toilet trained. Don't assume that they'll be a lifelong nappy wearer. So many children can learn to be clean and dry, even with significant learning disabilities. It's often tempting to wait until children are older before intervening. And we've got to have sympathy for parents. You've got a child with additional needs. You may have problems with sleep, with feeding, with gross motor skills, fine motor skills. There's so much on that family's plate. The last thing on their minds is starting on potty training. But think about it from the child's point of view. If they spend years wearing a portable toilet, that's what a nappy is after all, and using that portable toilet, and then we say at some point, maybe when they're 6, 7, 8 years old, we say, oh, now we're going to start using this toilet in the bathroom. How difficult would that complete change of behaviour be for us with normal cognitive ability, let alone for a child who's got a learning disability? But the message is, get on with it. The message is also that a child with additional needs is a child first, additional needs second. So let's just follow the regular potty training advice first of all. But nevertheless, it is difficult to work out the right time, isn't it? So when is it going to be the right time to toilet train this child? Well, it doesn't have to be guesswork. We can have a look at this bladder bowel assessment chart. This is another of those really commonly downloaded areas of the website because it's such a useful tool. Like all the other charts and diaries, we've got our instructions there on the back to help the child's parents see exactly what they need to do. So what's the point of a bladder bowel assessment chart? And it's to assess the bladder and bowel. It's to see what the intervals are between the bladder emptyings. That's one of the key things that we want to know here. Now, a parent may say, well, I change their nappy every 4 hours and it's always wet, so that's fine, isn't it? Well, it is fine, but that doesn't tell you whether that wet nappy is wet as a result of one great big void or 2 moderate sized ones or 10 tiny ones. So it doesn't tell you how the bladder's behaving. And that's what we need to know if we want to work out when the child should sit on the toilet when we want to try and toilet train them. So we want to check the nappy every half an hour during the waking day to see if it's damp, wet, soaking or dry. The only thing is, modern nappies are so good at wicking the wee away that it can be very difficult to find out if the child's done a little wee or maybe they're just a little bit hot and sweaty. So what you need to do is to put something underneath the nappy that's going to stay proper wet if they wee, even if it's just a little drop of wee. The cotton pants under the nappy, or maybe some folded kitchen paper inside the nappy. And we check it every half an hour and note down damp, wet, dry, soaking, etc. On the same chart, we write down everything that's happening with the bowels. On the same chart, all the fluid intake. So then when we come to interpret it, what sort of things are we going to find out from it? Well, it may be that we can see the child is wetting every half an hour, every half an hour to an hour. That bladder's emptying far too frequently, and that's not conducive to toilet training. So why might it be that the bladder's emptying so frequently? Well, if we look in the stools column, it might be that we've got type 1 poo, type 2 poo, type 7. Indications of constipation. It could be the constipated bowel pressing on the bladder that's making it empty too frequently. On the other hand, we might see that the bowel side of things is fine. And we look over here and we can see, oh, the fluid intake is very poor. Maybe it's the concentrated wee irritating the bladder and making it empty too frequently. Or maybe we can see the child's drinking coffee, Coke, coffee, caffeinated drinks that's stimulating the bladder to empty when it shouldn't. So we can use the bladder bowel assessment chart to work out exactly what the bladder's doing, see if it's being influenced by the bowel or by the fluid intake. Once we've got those right, hopefully we can see that the bladder's emptying at intervals of an hour and a half, 2 hours, something like that. If it's still emptying really frequently, even when we've checked out for constipation and got all the fluid intake right, then maybe this child has got some bladder overactivity. And just because they've got an additional need doesn't mean that we wouldn't treat that overactivity to enable them to become toilet trained. So let's see where this fits in to the flow chart we were looking at before. So let's go back to the flow chart for children with additional needs, and we can see that it says here, family to complete bladder bowel assessment chart. And then a healthcare professional needs to review the bladder bowel assessment chart with the family. And if we find constipation, jump off here and go to the flow chart for constipation and do another bladder bowel assessment once we've sorted it. Review it again. Maybe we find some daytime bladder symptoms, so we go to the flow chart for daytime bladders. And then you never guess what? Yes, we need to do another bladder bowel assessment chart until we've got one that says, yeah, we've got no concerns here. What do we do then? We've got another tool here that can help us. We can do a toilet readiness assessment. Now this one is a little bit like the continence assessment form in that we've got something different on the print ready version to the online version. The print ready version, the form we'd fill in, just asks us some straightforward questions. Have we done the bladder bowel assessment? Is the interval between voids at least an hour and a half? Are they passing soft stools between 3 times a day to 4 times a week, etc.? Simple questions to which we answer yes or no. If we look back at the online version, then we can see that we've got 2 columns. So if the interval between voids is not at least an hour and a half, why might that be? Here's some suggestions of what to look for. If the interval between poos is wrong, then there's the information in the column on the right. So, and similarly, if they're not able to sit comfortably on the potty or toilet for at least a minute, let's think why that might be. As it says, if the answer to those questions is yes, and the child is ready to commence toilet training, we can use the bladder bowel assessment chart to plan a toilet training programme, timetable for when they should be sat on the toilet, and there's all the other things to consider about awareness, communication, participation, behaviour, etc. So that's the toilet readiness assessment, and hopefully we're going to find out that the child is achieving sufficient skills and we can draw up a toilet training programme. There's more information about that on the leaflet we had a little look at before, the ERIC's Guide for Children with Additional Needs. And also the ERIC website is a dynamic website. We're going to add some more information here about using drawing up individual toilet training programs using social stories, etc. But let's look at the other alternatives. What if they're not achieving sufficient skills? What if they're not ready for toilet training? Well, it could just be because we can identify some issues and address those. Maybe they've got some sensory problems. This sensory needs and toileting factory is packed full of fascinating information to help us understand our children. And I think that's a really pertinent quote. See behaviour, think sensory. I'll leave you to read that at some other point, but we've got, it may be that we need to think about those sensory needs, or maybe they're doing something like smearing that we need to address. Lots of information there. Whoops, didn't mean to click on that one. Let's just go back to where we were. So it could be that they're not ready and we can see something that we need to work on, or it could be that they're not ready and we say they're not going to be ready for the foreseeable future. And then, and only then, do we consider the child's eligibility for provision of continence products. And when we do that, we're going to follow the national guidelines for product provision. And we can follow the assessment tool for issuing containment products that's within the guidelines. And it could be that that shows us that, no, this child is not eligible for product provision. And then we think, well, why not? It'll give us something to work on with the family. We can get the child ready for toilet training and we can repeat that toilet readiness assessment. On the other hand, they may be eligible for products. And then what do we do next? Well, we're going to consider suitable products. Is it going to be washables? Is it going to be disposables? Let's think about the right size. Let's think about the absorption we need. And we need to make sure that the family is given some samples of identified products before we place the order. Then get the order in place, and then when the family are provided with the product, give them some suitable information about using disposable containment products. We often skip this and parents say, but the products leak, or they don't seem to fit properly, they don't contain the wee or poo very well. It may be just that they're storing them in the wrong place, or they're not fitting them correctly, or that they're using an oil-based cream on the child's bottom, or some talc, or something like that, which will stop the product working properly. So lots of information there in just a simple fact sheet that we can print off with guidance on how to optimise use of disposable containment products. What do we do then? Well, I think it's important to note that the child who's using containment products, we want to continue to review things. So review the suitability of the products after 3 months after initially giving them to them. And then what do we do then? Well, for children for whom toilet training is anticipated, we want an ongoing 6-monthly review. We want to keep working this child towards toilet training. But for some children, very small numbers, but for some children, toilet training is never going to be possible. What do we need for them? Well, they still need an annual review. We need to check their bowels. Is there any constipation? Check the bladder. Is there any possibility of urinary tract infection? Check their fluid intake. Do all the things to really work on their healthy bladders and bowels. This child has got a right to have a healthy bladder and bowels, regardless of the fact that they're not going to get that wee and poo in the toilet. So we can use the resources that we looked at before to assess the bladder and bowel, work out what's going on and make sure that their management is optimised. And of course, we're going to look at the suitability of the product, the size, the type, the absorbency, etc. So when we're thinking about children's transition to adult services, perhaps the best transition for a child would be to really work on healthy bladders and bowels, to really work on optimising their potential for toileting, to really work on appropriate use of pads, to ensure that whatever they're being provided with is in line with what will be provided by adult services. If you want to know more, then do have a good look at the ERIC website. You can see it's packed full of a wealth of information. If you look in the professionals area, you'll be able to see that there are a range of training courses, and there's lots of information about them to be found there. But in particular, I'd like to draw your attention to the ERIC conference, which is happening later this year. It happens every other year. And if you look at the conference programme, you'll be able to see that this year's is particularly pertinent to children with additional needs. Equality and inclusion, making sure no child is left out or left behind. And as you can see from the programme, there's a number of really worthwhile topics with some great speakers for the plenary sessions and also for the afternoon workshops. So do have a look on the ERIC website and consider coming along to this year's ERIC conference. So I think that will do for now. So thank you so much for listening so far. And I think now we're going to continue with some questions and answers.
Thanks to Brenda for a really fascinating session. I would now like to give you a quick overview of the products and services that Essity provide to help manage incontinence in children. Before I discuss the product and support available, I think it's really important to highlight the consequences and impact that incontinence can have on the child, their family and society. Research has shown that children and adults who are incontinent are more vulnerable to social exclusion due to difficulties of changing when out and about and dependence on others. They are more at risk of abuse due to the need for intimate care, and they are more likely to need residential care as adults. Parents of children who were incontinent experience more stress than parents of children with disabilities that are toilet trained. All steps should be taken wherever possible to support an effective toileting regime and for that child to gain continence. However, Essity do have a wide range of children's products that will suit most infants and toddlers, including small babies. The Libero range includes open nappies and pull-up pants. The range is endorsed by Asthma Allergy Nordic as the Nordic Swan label for sustainability. As the child grows out of the Libero range, then Essity offers alternatives in the Tenor range, and those options include Tenor Slip Junior, Tenor Slip Extra Small, and the Tenor Slip Plus Active Fit. This year we have launched the Digital Resource Pack for healthcare and educational professionals working with children and young people. This resource pack provides easy remote access to product information, educational resources, additional support packages, continence guidance, and access to support services. Tenor Community on Facebook is another avenue which offers support and education for parents. Self-help guides, fact sheets, educational material, and continence promotion tips are all available. And also this year, we launched the Tenor Professionals Facebook page. This page is specifically designed to help in continence care. It provides, again, easy access on information and the latest guidelines relating to continence care, product information, and upcoming educational events. And we're really proud of PATH. It's brand new from Essity and it's our gold standard education platform. This pulls all of the educational material that Essity has to offer from a diverse selection of therapy areas into one easy access platform. Learning styles include bite-sized training, webcasts, e-learning and masterclasses. It allows the healthcare professional to pick their own educational journey, which best fits their needs, enabling them to meet their continuing professional development requirements and also supporting best practice. For further information, please visit the highlighted booth in the Learning Zone section. Thank you.
Hello again and welcome to the live element of tonight's event. As I said at the start, my name is Steve Ford and I'm the editor of Nursing Times. I'm delighted that joining us are tonight's speakers, Brenda Cheer, paediatric specialist continence nurse with Eric, and also Sarah Murray, clinical consultant with Essity, who you've just heard from. So, audience, now is your chance to ask any questions that you have on continence care and children and the transition to adult services. We've got around 10 to 15 minutes, so please get your questions or views in using the chat tab in Swapcard and I'll ask them for you. So to start, I guess, well, we've had lots and lots of practical information and advice in the presentation, so you've already covered lots and lots really, but we've already got one question in from Alison Gamison, and she asks, do you have a resource for carers to record the amount of stool passed as well as the type?
The poo diary really has every aspect of the child's poo included in it. So I can't show it to you now, but if you just go to the ERIC website and the search function works quite well actually. So you can just, if you don't remember where to find things, just search poo diary and you'll see that it asks for the date, the time, the type of the stool, the amount of stool passed, whether it was in the toilet or whether it was into their pants or a containment product. Yeah, it's a comprehensive tool with instructions that you can print on the back. So have a look at that. I think you'll find what you want.
Perfect, thank you. Moving on, you talked about learning disabilities and the need to tackle potty training, just anyway. Victoria Manetzi, points out that, bowel and bladder can be very difficult with severe learning disabilities and ASD children. Particularly, she notes fecal throwing and also fecal eating. So the question is, do you have any extra information that can help with this on top of what you've already told us?
Yeah, I think the resource you want to look for is the one that's entitled smearing. Okay, so I know you're saying you're talking about eating stools, throwing stools, but I think all the information you want is in the smearing document, because it talks about sort of why children do start smearing in the first, or start all these poo behaviours in the first place. And then it talks about how we can move them away from those behaviours, both by reducing their access to the nappy area, to reduce the possibility of them getting hold of the poo, but also, why do they continue to do it? Often it's because of sensory fulfillment that they get from playing with the poo, eating the poo, whatever. And it talks about how we can replace that sensory fulfillment with messy play, with sensory sensory stimulation in other ways. So that's all in that fact sheet. So with all the fact sheets, you can just read them online, and of course then you can translate them, or you can print them at the click of a button. So hopefully that one is the one you want. Smearing, it is packed full of information and it does work. Yeah, I've got one of the little boys that I'm working with at the moment who was referred to me because of smearing. I don't see children through Eric. I hasten to add, just in case you think you can refer children to Eric. But he was referred to me outside Eric, and yeah, the referral was all about the smearing, and he's now getting probably 99% of his poo in the loo and is doing loads of sensory play, and it's really, really working. So yeah, there is a lot we can do for children, and there's a lot of resource on the ERIC website.
Great, thank you very much. Caitlin Murphy, so this is moving on to transitioning to adult services. Caitlin basically wants to know really what some of the barriers that are likely to be faced in that transitioning, and I imagine how your advice on how to get over them, what the challenges are, and how to get around them.
Yeah, I think one of the things is really understanding the adult services in the area where you work, so that you're working towards working together, and help and guiding the family towards what they'll need to know, what they'll need to do when the child is an adult. I think one of the biggest obstacles is actually the sort of fear of the unknown. One of the biggest obstacles is just thinking, this is what you have now, this is supported, the support in the perhaps nurturing children's continence service that you've got, and then what's coming in the adult world. And I think if we as paediatric practitioners can be really well aware of, in our area, this is what happens. You transition. Is it 16? Is it 18? Is it 19? Is it 25? The services are very, very different across the country, which is why the ERIC information doesn't attempt to be about service provision, because it's really difficult across the country. So I think all the paediatric practitioners need to make themselves aware of what the journey will be into adult services. And similarly, I think it's very pertinent for adult services to know what happens in the children's world in their area, so that we can work together. I think that's what it's about. It's about working together and making sure that transition is not an event. It is a process, so that the child is, we're working the child towards transition for some time before the actual data transition. And it really is a journey that we go on together with the family, with the paediatric services, with the adult services. I think if we do that, then most of the obstacles are actually minimized. But I think also, as I said in the recorded talk, making sure that from a product provision point of view, making sure that what paediatric services are allocating matches what adult services are allocating. That's really key as well, because sometimes parents of children, as I'm sure I'm smiling because I'm sure we can all think of parents of children with complex needs, often are out to fight for their rights and to fight for additional products, and then they go to adult services and actually they're not going to get those additional products, and nor should they. We should be managing children's continence in an optimal way. It shouldn't just be about extra nappies. If the child's got a problem, we should be looking at why they if they're doing a poo 12 times a day, then it shouldn't be you need 12 extra nappies. It should be, why is that child pooing 12 times a day? Is this constipation and overflow? Is there something that we haven't worked out about this child? And just because they've got an additional need and needing to use an absorbent product doesn't mean that we shouldn't be investigating them properly. But I'm sure you can all think of families who've fought for their child's rights, and I really admire them for their care of their child, but that doesn't necessarily help their transition.
Yeah, I can imagine. Yeah. Great, thank you. Right, so moving on, Becky Boxall. So she is a special school nurse, a specialist school nurse. She says she often finds that children and young people may toilet at school but won't at home, or vice versa, due to compartmentalizing. Do you have any specific advice for families, because it can be obviously so frustrating for them, she notes?
Yeah, no, Becky's absolutely right. We hear of this sort of thing all the time, when the school is working really well with a child, or vice versa, the school can't do anything with a child. So I think it really is about working together. And again, it's about preparation. So, if the school is going to work towards toileting with the child, then we need to bring the family in and think about everybody that looks after the child, because that's one of the problems, is that children with additional needs are often looked after by a respite service, by the parents, by the school. Maybe they have a PA as well. There's lots of different people that may be involved, extended family members, etc. And if we don't work together, then we've all got our slightly different way of doing things. So it really is about working together, thinking early before we start toilet training. How are we going to work together so we've got the same things happening at school, at home, at the respite service? Because, you know, to stop that even happening where the child will only use one toilet. So I think that working together is one of the key things. Another thing is just the practicalities. You know, if we're needing to use an adapted toilet seat, then make sure the child has got the same children's insert or the same OT provided toilet chair wherever they are. You know, making the room look as much the same as possible. We've got familiarity, so things like putting up child-friendly pictures that really work for that child, same ones wherever that we're expecting them to toilet. So we really help it to be the same kind of environment wherever they are. I think another thing is sorry, that's just slipped my mind. I was just going to tell you another thing. Do you know what? It's just slipped my mind. Steve, have you got anything to add there, or you know?
If it comes back, it's fine. If it's not, it's absolutely
if it
fine
comes
too.
back, I'll throw it in. Yes.
Great. So a question in from Annette Hindle. Again, this is a more general one, I guess. So Annette she points out that, well, no, she asks really, do you think a lot of children are actually missed, and that's why a lot of adults have constipation and just see this as a norm?
I think that's a very good point. Yeah. You know, we need to raise awareness of bladder and bowel health across the generations, and really crucially starting with early years. So we, you know, at ERIC we have a couple of resources. One's thinking about wee and poo now you've reached the age of 2, to go along with 2-year checks. Another one's thinking about wee and poo now you're on your way to school, to thinking about those school starting ages. Those are really key times to be thinking about bladder and bowel health, and to be thinking about early intervention into children's bladder and bowel problems. So, but then we need to continue that journey, don't we, across the generations, because I completely agree. Yes, sometimes people say, yeah, they poo twice. No, they're not constipated. They poo twice a week. There's loads of it. They can't be constipated, can we? So they're fine, aren't they? That's what they do. And no, of course, that's not fine. You know, pooing twice a week is constipation. But if they grow up thinking that's normal from a young age, then yeah, they're going into adult life thinking that's normal. And then we've got all the knock-on effects on the bladder, on the, on the whole person. You know, we shouldn't forget that constipation is systemic. It's not just about poo. It's about the whole being, and how it affects our mood, our behavior, our general health, our ability to concentrate. Quite apart from our bladder, and then the knock-on effect on our kidneys, it affects the whole of it, and it's so easy to treat. So yeah, early intervention, increase awareness. And I think one of the things we do is just need to have those conversations wherever we go, not being afraid to talk about wee and poo. That's why I sit in Zoom meetings with wee and poo over my shoulder, so that we're actually making sure that, yeah, we're starting those conversations. And I think that's our responsibility as professionals, is to not wait for families to struggle and then start the conversation, but to just start the subject, start the ball rolling, talk about wee and poo, talk about the really practical ways that we can help families to manage problems.
Perfect, thank you. Amazingly, that the time has gone past very quickly, but what I want to quickly do is ask you both for a very quick take-home message that you want to give everyone before I wrap up. So yeah, I guess we'll start with you, Brenda, as we've
you put me on the spot now, Steve. Quick take-home message.
I know.
Well, I suppose I suppose what I would say is just exactly what I just said, actually, that to talk about wee and poo, so that it's not a problem, and to really just go to look at the ERIC website. There's so much information there, and sometimes people say, yeah, we tell parents about ERIC, but don't just say go and look at the ERIC website. Search it, find the key things. When there's lots of information, that's really difficult for families. Say, look here, this is the information you want. So that wasn't very succinct.
No,
But
well,
there we are.
that's all good. And Sarah, very quickly from you.
I think really from a product point of view, very similar to what Brenda has been saying, it's really about communicating and planning. We know with children, even just moving from one size product to the next size product to a different style of product, it's not something that a lot of children and families can manage overnight. So it's kind of having that communication, having the plans, always thinking of the next step, what's going to work for the next step in their journey. And we've got a really good, if I can mention, it's called Tenor Family Care App. It's a really good tool. It's an app that you can download. It was designed very much with an older person in mind, but actually when Brenda was talking about having lots of different agencies involved, maybe personal assistants, schools, continence, bladder and bowel services, parents, different sort of family settings, it enables everybody to communicate around the children's toileting needs, toileting sort of progress in one easy place. So if people are sort of interested in that kind of thing, I definitely recommend having a look at that.
Fantastic. Thank you very much. Again, thank you to everyone that's taken part. As we have obviously run out of time very quickly because it's such a brilliant conversation. Thanks very much to Brenda and Sarah for sharing their expertise, and ST for sponsoring the event. Hope to see you again tomorrow for the next of our webinars in support of World Continence Care Week, when we're looking at stroke and transition to community services. And don't forget, you can watch back today's webinar and any of the others in the series. So goodbye for now. Thank you very much.